Hi, I'm Catherine Wilkins. I'm a registered nurse at Pullman Regional Hospital, and I've been a staff nurse in the emergency department for a number of years. I'm also the pediatric care coordinator for the hospital. Today I want to talk to you about child safety surrounding the use of marijuana and specifically exposure to edibles with children. As marijuana has become legal in Washington state as well as other states across our nation, there's been a marked and significant incidence of pediatric ingestion regarding edibles. And of course it makes sense, as marijuana is more widely used and readily accessible, it's also become more accessible to children. Why are edibles dangerous for children? There's a number of reasons. Two specifically are that the concentration in THC is higher, and also there is no regulation on labeling or child-proof packaging on edibles, and the packaging is bright and colorful and attractive, especially to children. There's really nothing that differentiates the packaging between regular candy or cakes or cookies that you might see at a grocery store versus something that's unsafe. So what happens with an exposure? With an exposure to a child, the symptoms can range from anything from excessive sleepiness clear up to coma. And we see a variety of symptoms in between. Particularly, there's been instances of bradycardia, which in a child is significant as an arrhythmia, as a slow heart rate. There's also been problems with respiratory distress as they become more and more sedate. And in those cases, they have to be intubated. There's also been instances of seizure and, as I mentioned, coma. So it is a very dangerous exposure for a child. There's also some difficulty in diagnosis at times when caregivers or parents are not forthright with information, and it creates some confusion surrounding the diagnosis and nature of the illness. So what do we do for prevention? American Academy of Pediatrics suggests that adults don't use marijuana in the presence of children. However, if there is going to be marijuana in the home, they suggest that it's kept out of reach and out of accessibility, just like any toxin in the house. So stay tuned for Dr. Mickelson's upcoming video on alcohol abuse.